Welcome to the In My Opinion show with Ronald Bay Robinson and friends. Seen on the internet 24 hours, 7 days a week. To view, please go and type in capital letters RBRIMO to view our vast catalog of programming. Also, the In My Opinion show is seen on Flint, Michigan, Comcast Cable Channel 17 every Saturday at 6 o'clock and every Wednesday at 8:30. It's also seen on Detroit, Michigan, Comcast Cable Channel 68, 7 days a week. I want to welcome our millions of viewers worldwide. I also want to welcome my very talented co-hosts, Ms. Jackie Williams.
Thank you.
And Mr. Henry Hatter.
Hi, Ron, and welcome, Jackie. It's good to see you again. I know we're going to have a great show today.
That's right.
Here on the In My Opinion show, we ask the hard questions that other people don't or are afraid to ask. The success of our show is due to our viewers and the dedicated men and women that make this show possible. Thank you. Let's talk about do you believe the government should mandate health care coverage for everyone? 7 million and counting have already signed up for affordable health care. It's like breathing fresh air. I know that there are forces out there trying and talking negative about the Affordable Health Care Act or Obamacare. Lies are everywhere, but these pundits of lies have offered nothing in response to this ever-increasing cost of health care. In the past, healthcare providers were bankrupting us ordinary citizens. With high costs, with the Affordable Care Act, those high premiums will come down, and those same high-priced insurance companies will no longer be able to make billions of dollars in bonuses and profits. I mean, what's your thoughts?
Well, Ron, I do believe that I was happy with the Medicaid and Medicare. I thought that there were some nuances that needed to be fixed. Like, for example, to have children remain on their insurance policies until they're 26 years old. Existing conditions needed to be changed, as you find in the Affordable Care Act. I believe that 80 or 90% of the American people believe that. And but I was not happy with the American Affordable Care Act because it cost us $3 billion to insure 45 million people. That added a cost of $3 billion. And yet, by tweaking a Medicaid, Medicare, could have done the same thing. But the fathers in Washington had a better idea, I guess. But everybody should have health care. Everybody in this country should be taken care of. I don't mean taken care of, should have earned the right to have health care. There's nothing more dreadful than a family without health care because it threatens life. And none of us want to see any portion of our family suffer from diseases or harm or pain. During our lifetime, we can't help them. But in this case, I believe that the American Affordable Care Act has done a good job in providing for those who can't provide for themselves. That's where the basis of health care ought to be, is providing for those who can not provide for themselves. But the Affordable Care Act is an umbrella to all Americans. And therefore, I can see that this is going to hurt the country because in the long run, we may not be able to keep these commitments because we are a nation in decline. Our population is rising. So what they will do is go into my Social Security reduce my benefits, and share it with others. It will do that for every one of us. We will be mediocratized in the whole process. There's just no other way that they can balance the budget due to the health care burden, other than to go into Social Security, Medicaid, Medicare, where 90% of the funds are located. What we do with the national security and now the with our budget to keep systems running is only a drop in the bucket. But most of the money out there that we have saved, we owe it to ourselves, and that equates to about $60 trillion. There's a big snowball behind us, and all of this has to come due at some time. And how we will pay for all of this, I'm not sure. But yeah, the Affordable Care Act does provide some relief for the bulk of the family. The other thing that I don't like about it is that it forces industry and business leaders to abandon their own health insurance program and let this burden fall on government. And how that will work out in time, I'm not exactly sure. But I think that somehow Americans will be able to pull it together for us to maintain a stable and secure economy for ourselves.
Jackie, what's your thoughts?
Well, that's funny. You watch TV and you watch all of the statistics and you hear about everybody and the way that they feel about the Affordable Care Act, also referred to as Obamacare. And it's so funny how so many different people view it. Now, some people view it as a savior because some people were working and they had to get Medicaid because they couldn't afford insurance. Even though they had good, viable jobs, they couldn't afford insurance, or some companies didn't offer them insurance. So this is a chance for them to work at a job and not use half of their income to pay for ridiculous premiums of insurance. So that means that they all can now have insurance and also have jobs. So I think it helps a whole lot of people. Now, I disagree with the numbers because it's so funny how the numbers vary, depends on who's talking about. You know, you hear some people talk and say that, you know, it is balancing because we spend so many dollars caring for uninsured people every year. We even have hospitals that are dedicated to uninsured. So it has to be a big bill in order to do that, because so many people don't go to the doctor because they don't have insurance. And so when they finally do go to the doctor, back to that snowball effect, you have so much, the bill is just out of control because things that could have been prevented if they had health care were not prevented, and now you have all these high costs because you need all this testing at one given time versus you have it preventable. So by people having insurance now, you can prevent and, you know, catch things early where you're not having to have surgery, which is more expensive, as opposed to going to the doctor. And they're not afraid to go see if something is wrong versus having to be sent in by ambulance. So it depends on which side of the fence you're talking about, because I know a lot of people that have good, viable jobs and their employer would rather pack their pockets than assist them in having health care. And it's not fair. It's not fair that half Americans have never had to worry about that because they can afford it versus the people that just couldn't afford it and just allowed to go sick or have other issues.
I think Jackie has a good point here in that the Affordable Care Act will force more people to look at their health conditions and to do preventable things so that they prolong the health care. And the way we live today with abundance of health care and services, we're not going to do that. It has to be force-fed to the American people. But I think that's a compelling argument and a good one to support the Affordable Care Act as it exists today. But you're right. But what we need to do is to make sure that we don't. And by the way, health care carried by the government what's called Medicaid and Medicare. We've had that forever. And it has benefited the American people. And there are only a few people who were not covered by Medicaid, Medicare. You could be, let's say, a 30-year-old woman without a child. Okay, and then you have cancer. Then you're too old for Medicaid and too young for Medicare. You would fall through the crack. I've seen evidence of that. But by and large, most people were covered by Medicaid and Medicare. But except for those few nuances where kids were released from their parents' health insurance and the pre-existing conditions. Those really hurt Americans, and that needed to be taken care of, and this is what the Affordable Care Act does. But otherwise, Medicaid, Medicare did a great job.
You know, Henry, you mentioned that, there's $3 billion.
Yes.
Now, for me,
3 trillion. 3 trillion.
okay,
We went from 14 trillion to 17 trillion.
okay. Now,
Implementation.
if one has a debilitating illness, money and our loved ones, I mean, I would walk through hell to try to come up with that money, all right? Now, a story that I haven't told anybody is that if I didn't have good insurance, my wife passed away, all right, from breast cancer, okay? And those bills were just outrageous. And if I hadn't have had help, and if she hadn't had insurance, I mean, I wouldn't be sitting here probably right now, all right? Because I'd probably would have had to have 5 or 10 jobs to pay the doctor bill.
Right.
So I can see the devastation that was about to take place had not the Affordable Care Act come into being. And I hope it's successful. Over 7 million have been signed up thus far, and there's still another couple of days. I'm hopefully maybe we can reach 10 million, and it's got to be a success. And what Jackie was saying, I'm so sick and tired of listening to all that bullshit, on the news. This pundit is saying, I lost my insurance, and this other one is saying I lost my insurance, and all of these lies. And I'd like to know who's backing these lies. All right, it must be the insurance companies.
But the sad thing, Ron, is when businesses refuse to give their employees health insurance.
Mm-hmm.
That was at one time part of their responsibility.
That's right.
Now they say, well, I don't have to do that. I'll just pass that on to the federal government and let them take care of it. So what we've done is we've watered down a tight, fast system
Mm-hmm.
and allowing that to flourish. And it will consume us all.
Now, isn't it true that this is what I find funny, is that when you look in the paper or on the internet and you see companies like Davis Bridal that laid off so many people because they say they couldn't afford to offer, but the mandate hasn't even came yet. And it's so funny that you're blaming it on that, but the mandate hasn't even came yet. And so I was blogging like it hasn't even came yet, and you're blaming that you're laying off people because you can't afford it. You haven't even had to do it yet. You haven't had to do it yet, so everybody's mad because they're thinking the Affordable Care got them laid off, and that's not true. So people are lying to hold up to what they want to do. You wanted to lay them off anyway, so you had to find a scapegoat.
Yeah, to bolster their bottom line.
And a lot of legislation, Ron and Jackie, takes on a life of its own. Once it's implemented, you got people out there who are sitting on purchase to take advantage of the nuances that exist in it. And they do. And that's what's happening. And until we bring it back to center line where it's regulated in a process that protects the system from destruction and defeat, we'll have to live with it the way it is. But it will come back. But for right now, there's opportunity for those who are greedy enough to sees advantages.
But what about the vulnerable people that
They
don't know?
don't-
Because they have some emotional tags, like the one about, she had cancer and she can't go to the doctor. That appeals to women especially because we're emotional people. So when you stand up there and you tell us that you couldn't go to the doctor because they took your insurance, that scares people, even though they might not know all of the information. That scares you to thinking, oh, this is a horrible situation.
Now, business people do say these are business decisions. This is good for the company. We cannot survive without reducing our cost. And they can make the case like that and have it supported in courts and through the public and through the media. And it becomes the part of the way we live.
Okay. But I just think, like, my company that I work for, we have a lot of properties, but in our particular company, where I work, we only have like 3 employees. So we fall under the number. And I have a coworker that, they're not comfortable going to the doctor, where I have insurance through my husband, so I go to the doctor all the time. You still have, because you don't have healthy employees, and you have to think about that too. You're not having healthy employees and employees with good attitudes because they're not able to take advantage of.
Now, when you said you go to the doctor all the time, you're not abusing the system, are you?
No, I'm going. No, it's called preventive. Matter of fact, they send me emails
Because
and say, we want to make
That's what has happened in the past and drove us to where we are now.
No, I'm not being abusive, but I'm being preventive because I have to make sure that I'm taking care of myself so that I don't
I
snowball and
understand.
have all of
Yeah.
those expenses.
Sure.
That most people have when they finally go to the doctor. But I thank you for trying to throw that at me. But I'm innocent for that.
I am defeated.
We're going to change gears here. Welfare drug testing in Michigan. We've had our democracy councils with the implementation of emergency managers in our schools and cities, mostly African American communities. Now the state is poised to test welfare recipients for drug abuse. From past practices, this will be instituted in minority communities. According to published reports, the drug abuse is more prevalent in the white community. The war on black people must stop now. Racism is alive and growing in minority communities. Now, we all know that the black population in the country is approximately under 50 million. The white population, the black population in the United States is around 50 million. The white population is pretty close to 300 million. So, by sheer numbers alone, you can see who has the drug issues. It's not the minorities. Why are the African Americans always blamed? All right, for this for all these untruths. Jackie, let's start with you. What's your thoughts on this?
Well, actually, I disagree. I think it's great for them to do testing because I work in subsidized housing. And what I have found is that we become entrapped in our situation when we're not required to do certain things. It's sad to say, but it's the truth that most of the residents get their kids to school late, even though they're not working because of their activities. And when you don't give certain people guidelines, they tend to live free. Where they don't have any responsibility. But when you put down guidelines, they have to get in line or they lose things because some people don't appreciate things because they don't earn them. So if I'm not working for my dollars and I'm not working for those benefits, sometimes they're not as important to me because I feel like you just owe me something. But if you hold me accountable to the things that I'm getting, then maybe I would do better. Because a lot of drug use is in those type of communities because they have nothing but time. They have a lot of time on their hands and they're not being productive. But this is not just in the black community. This is in all communities where they're at home all day just, wasting time and not making good, being a good steward of their time. So I think if I have to go to work every day and I'm held accountable to make sure that I'm not on drugs and I earn a paycheck, why would you not have the same criteria that I have? I mean, because you should have the same rules that I have. You should not have benefits to be able to do things that I can't do, especially when my tax dollars are paying for you to be able to sit at home and do those things.
But aren't you being a little stereotypical? Okay, let's take Flint, for example, all right? Minority black city, okay? There's no jobs. That doesn't mean that people should use drugs or anything like that, but people need that helping hand up, okay? There's families that are living, 4 and 5 families, in a 2-bedroom or a flat. So, jobs is the key, in my opinion. Jobs is the key. There is no jobs per se in Flint. Okay, what is it? Over 60% of our children now are dropping out of school. So therefore, they're not going to have a future. So if they were brought up in a, not all, okay, but if they were brought up in one person by their mother or a single parent, and these generational things keep appearing all the time. And what I don't understand is that we've spent all this money on education, okay, but yet 65% of these girls and boys drop out of school. That's got to change. But this drug testing, and I know damn well that when they start this, all right, who's in charge of the welfare? All right, the state.
Right.
So if the state says, okay, you, and you, come on, let's go drop this urine, I think that's unfair.
I mean, why do you think that's unfair? Because if I'm working and if my employee do a random drug test, which they do, and I have to go in and do random drug testing, why is that any different from someone that's receiving benefits just like I am by working?
Well, if it's random, all right, there's a difference between random and profiling. Okay? And I can see that that's what's going to happen. They're going to profile minorities.
But one thing I do see is that also, if you go to the Career Alliance and they tell you, they'll have a group, they have like job trainings, because there is some jobs available, but you can't get to the job if you're sleeping all morning and all of that kind of stuff. So it is some job trainings, but as soon as they tell you that there's drug testing, half of the people in the room will not get up. So we're canceling ourselves out for even moving forward by having these issues. So I think if you put in guidelines to help restrict these issues, that it would make you more accountable. If you know, okay, if I'm going to lose my benefits, maybe I shouldn't waste my time doing this. Yeah, there may not be jobs, but at one point I got to have some self-esteem issues. I got to get it together or I'm never going to move up. And some people can't move up unless you push them. Some people you have to push to do better. And if my generation is not graduating and I just keep saying, well, you drop out of school and you just drop out of school and, you just come and do what we're doing. But if you push them and say, hey, you're not going to get this if you don't do this, sometimes it pushes you just enough for them to make a difference. That's
What's your thoughts, Jim?
I hope I can make a difference in this argument, Ron. But I believe that I'm talking to a Republican. Jackie, I am really, I don't know whether I'm impressed or whether I'm appalled, but those are strong Republican views. And about self-reliance, self-esteem, looking out for self, not depending on government and stuff like that. Getting up and making a difference in the world for yourself, by yourself, and to yourself. I believe that drug testing should occur. And I don't mean to paraphrase Jackie either, but I'm going to say it the way I look at it and the way I believe it. There are 3 reasons why drug testing should occur. First of all, it is the law. And the law is very important to protect us all from ourselves and from circumstances that's beyond our control and things that we cannot take care of. And it is easy to commit others who derive funds from the state at no cost to them to commit to drug testing because they are having their health care and benefits provided by the state. And I believe that for people who can afford this, it's up to them to do their own risky behaviors because they have the money to take care of themselves. And I believe I would be cautious about using a racial argument because, and Jackie said it a little bit to my tilt, that it occurs in every segment of the population. And we need to make sure that we protect our young people from self-destruction of themselves. We need to try to move it away from them because it's very important for us as we move into the future. Now, this is not to say that there aren't people in a segment of the people in the population that will not continue to be abusive to people who don't look like them. They're in the judicial system, they're in law enforcement, they're in our families, they're our next door neighbors, they're Republicans, they're Democrats, they're independents, they're like us. And they will always have these kind of lurid arguments to make to blame blacks for being the worst they are in drug use and the most dependent.
This has been a great. I wish we had more time, but we have to cut this short. Our time is up. We had a great conversation, but this is Ronald Barry Robinson and friends for the In My Opinion show saying until next time, stay focused.